All right, today we're diving into an antibiotic that, honestly, kind of breaks all the rules. It's been a trusted workhorse in medicine for decades, but it's got this one very specific and pretty surprising secret. Let's talk about nitrofurantoin. Think about that for a second. It's a weird question, right? Most antibiotics you've heard of are like a general army. They just flood your whole system to fight an infection wherever it might be. But what if a drug was more like a highly trained sniper, with only one single target in its sights? Well, that is the incredible story of nitrofurantoin.
So let's get right into it. The absolute key to understanding this drug is to stop thinking of it like a general-purpose soldier. Instead, you've got to see it for what it truly is: a specialist, a real expert on a very, very specific mission.
So what exactly is this stuff? Well, nitrofurantoin is in its own unique class called the nitrofurans. This means it's not a penicillin, it's not related to those common families of antibiotics. It is chemically its own thing. And for decades, it has been the absolute go-to weapon for treating urinary tract infections, UTIs. And when I say its focus is narrow, I mean it is laser-focused. Its main job, its whole purpose, is to take out simple bladder infections, also known as cystitis. You can really think of it as a sharpshooter, going after the usual suspects, like E. coli, right where they set up camp, inside the bladder. It's also fantastic at preventing those infections from ever coming back. So how does this specialist actually get the job done? Oh, this is where it gets really, really cool. It doesn't just use one simple weapon. It launches this incredibly coordinated, multi-target assault from the inside out. You gotta love this process. First, the drug slips right inside the bacterial cell, completely inactive, kind of like a sleeper agent. But then, the bacteria's own machinery, its own enzymes, unknowingly flip a switch that activates the drug. They literally turn it into a weapon against themselves. And once it's live, it just unleashes total chaos. It attacks the bacteria's DNA, it messes with its ability to make proteins, and it starts breaking down the cell wall, all at the same time. It is a complete internal meltdown for the bacteria. And here is the absolute genius of that strategy. Because it attacks so many different things at once, bacteria find it almost impossible to develop resistance. It would be like trying to defend your castle from 3 different directions at the same time. You just can't do it effectively. And that's a huge reason why nitrofurantoin is still so reliable after all these years. Okay, this next part is maybe the most critical piece of the whole story. Because a specialist, no matter how good, is only effective in the right situation. And for nitrofurantoin, there are some very, very strict rules of engagement. And here's the central paradox of nitrofurantoin. Its greatest strength is also its biggest limitation. See, it gets super, super concentrated in urine, which is perfect for a bladder infection. That's exactly where you want it. But here's the catch. It barely builds up in any other body tissues. So if that infection moves up into the kidneys, a much more serious condition called pyelonephritis, nitrofurantoin is completely useless. It's just not on the right battlefield to fight that fight. Now, this number right here, this is the golden rule. It refers to something called creatinine clearance, which is basically a report card for how well your kidneys are working. And if a person's kidney function drops below this level, nitrofurantoin is an absolute 100% no-go, period. And there's a really good reason why that rule is so strict. If the kidneys aren't working well enough, you get this double whammy of failure. First, the drug can't get concentrated in the bladder, so it fails to treat the infection. But even worse, the drug then builds up to toxic levels in your bloodstream, which can cause some really serious problems.
So beyond kidney function, there are a few other specific times this specialist has to stay on the bench. It's not used at the very end of pregnancy or for newborns due to a small risk of causing a type of anemia in the baby. And of course, like any drug, it's off limits if you know you're allergic to it.
Okay, so let's shift gears and talk about the practical stuff. If you are the right patient for this drug, what do you need to know to use it safely and to make sure it works?
First things first, a little heads up about something that can look pretty alarming but is actually totally okay. This medication can, and often does, turn your urine a dark yellow or even brownish color. Don't panic. It's a completely harmless and expected sign that the drug is doing its job.
Now, like any medicine, it can have other side effects. The most common ones are pretty mild, things like nausea or maybe losing your appetite for a bit. But it's the rare, serious ones you really need to be on the lookout for. Any signs of lung issues, like a cough, liver problems, or nerve damage, Those are red flags that mean you need to call your doctor right away. So, think of this as your safety checklist. Number 1, always take it with food or milk. This really helps your body absorb it and cuts down on stomach upset. Number 2, you have to finish the entire prescription, even if you start feeling better after a few days. And number 3, be vigilant. If you notice any of those serious symptoms we just talked about, shortness of breath, tingling, yellow skin, report it immediately. So, when you put it all together, what's the big takeaway here? What's the lasting impression of this really unique antibiotic? This quote really just nails it, doesn't it? Nitrofurantoin is the absolute definition of a targeted tool. It is incredibly good at its one specific job, but all of that power depends entirely on one single factor: healthy kidneys, to get it to the target and to keep the rest of the body safe. And that kind of leaves us with one last question to chew on. We often think about medicine in terms of brute force, right? Just find the strongest drug for the job. But a specialist like nitrofurantoin, it shows us the elegance and power of precision. It's a great reminder that sometimes the smartest solution isn't the biggest hammer, but the one key that was perfectly designed for the lock.